Hello and welcome everyone. Today, I invite you all to another episode of our FAQ session at InnoHealth Magazine. Uh, today we are going to talk about uh, a big problem which has been emerging since the last few decades. Climate change, it's no longer a distant threat. It shows up time to time in record-breaking heat waves across cities, in pesticide-laden fields, and affecting the lives of the communities before even they receive any support. Today we have Dr. Ratika Samtani, who is the assistant professor at IIHMR Delhi. Dr. Ratika has worked at the intersection of climate change and public health for years, and her research spans mapping 5 decades of extreme weather events across India, studying how pesticides exposure affects women's health, and the case of millets as both a nutritional and climate solution. So we are delighted to have her with us today. A very warm welcome, Dr. Ratika.
Thank you, Pinaki, and it's great to be a part of this. And thank you for inviting.
Okay, before diving right into the session, let's just first like put a ground at the on the discourse that we're going to have today. Dr. Atika, let's just start with the how and what climate change as a vocabulary. How do you define it? Like we hear about it constantly in news and policy discussions and let's say everyday conversations as well. For most of the people, it's like some big abstract problem which is supposed to be solved by some big think tank sitting at some government office. Where you sit as a researcher, how do you explain what climate change actually means for people's health, particularly, and why should in someone in India, let's say someone like me, who should worry or care about it?
Yes, that's a very pertinent question, Pinaki. Climate change, well, I would like to reframe it as climate solutions in today's time. But yes, climate change, when we talk about climate and health, we often focus on visible events such as heat waves, floods or air pollution, and then people say, okay, there is a increase in temperature, or the rainfall this year did not happen as per the pattern, and we call it climate change. But there is a bigger, deeper connection. When it comes to climate change, it is not just about floods happening, heat waves going wrong, or your rainfall pattern changing. But there's a deeper connection that receives very little attention, and that is your systems, the systems in place. And with that, how climate change affects the entire food systems, your agriculture, and what is actually coming on your plate, and then what exactly is going into your body. And it's not just us. Today, we are not just talking about human health, it's all one health. So how is it shaping the entire ecosystem and the biological, the biosphere, everything? How is it shaping that? So this is where climate change, this is where people need to think about how climate change is integrated into all these systems.
Okay, so now we've got the holistic picture of how it's not just the events that are happening externally, but also what's going on inside and what we're consuming as humans. So that's a very interesting way to put it. So let's just dive into the FAQ session itself. So my first question to you is. Climate and health discussions, they often focus on individual risks such as heat waves or pollution. If we look at the less obvious connections between, let's say, environmental changes, food systems, and population health, which might be overlooked by policymakers or even normal people like us, what do you think are those obvious connections and how would you address them?
Yes. To begin with, when we talk about climate change, we don't talk about weather patterns that are changing over, like I said, like I mentioned, which are changing over a day or or a month and so on. It takes centuries and decades and years and years and years for something to show an impact. So climate change is more of a statistical, being rather than just being a change in a day or so. Now, coming to your question that what are the less obvious connections, between environmental changes? I'll tell you, I'll start with a very simple example. This was a very famous landmark study by Harvard in which they say that climate change is not only affecting how much food we grow, but it also affects the nutritional quality of the food. And a very good example for this is the rising CO2 levels. So there was a study which they did that rising CO2 levels can, with the future projected CO2 levels, when that was applied to staple foods like rice, wheat, peas, soybeans, and so on, they found that the nutrient component of iron, zinc, and protein, they all were reduced. Now, now imagine a situation that if this actually happens, and if we are able to, if the climate change goes the way it is currently going, we might find solutions for proper crop yield. So tomorrow I may have food on my plate. Everybody may have food on their plates, but there will be a situation when the nutrient value of that food will be nothing. Now, this increases the risk of what we call as micronutrient deficiencies, and that we increase the risk of hidden hunger. And that is where the concept of hidden hunger comes, where people consume enough calories, but they still suffer from micronutrient deficiencies. Now, this becomes particularly important for a country like ours, where many people depend upon rice and wheat as their staple diet. And currently, women and children of our country already face and have a high burden of anemia and malnutrition. We are already in that zone. Then we coupled with the extreme weather events, like, we have floods and heat waves and severe heat waves, and they're all disrupting the agricultural production and food security. The good news is that we have solutions. And while we were doing our research on 50 years of IMD data, we did analyze the 50 years of IMD data with respect to different extreme weather events. We found a stark, there was an statistically increased trend with respect to all extreme weather events. So obviously that has a lot of, impact on what we eat, how we live, and so on. But like I mentioned, that we have a good news is that solutions do exist. Traditional crops, something that was grown, centuries ago, like millets, they are the ones that are, highly climate resilient. They require less water. They can tolerate heat and drought, and they are very rich in essential nutrients. Then coming off the Orissa Millet Mission, 2023, we celebrated the International Year of Millets. And why we did that? Because that shows that if we revive back the traditional food systems that can improve nutrition, strengthen livelihoods. It's not just about food. By reviving a particular variety of seeds, we actually strengthen the livelihoods of agricultural farmers, which were actually losing their lives, their occupation because of loss of wheat and rice, and so much of plantation loss was there. And also, this helped build the resilience to the climate shock. So, Orissa Millet Mission is such a beautiful model, which is now being adopted by different states. So, I often call millets as a triple win, solution. Like, they're good for farmers, they are good for people's health, they are good for the planet. And so this reminds us that climate adaptation when we talk about is not always about technology. Sometimes the solutions to this is rooted in our traditional knowledge and sustainable systems. Yeah.
Okay, so now, like that, you have touched upon a bigger picture. Like here, we're talking about farmers getting affected and the food that's coming on our plate. If we look at the Lancet countdown, that highlights that India loses almost like hundreds of billions of potential labor hours due to extreme heat, let's say extreme heat events or extreme weather events, and the burden squarely falls upon construction workers or agricultural workers. So now that climate change is often described as a threat multiplier, let's say, and that threat disproportionately affects vulnerable populations. So, in the Indian context, which groups do you think are facing the highest health risk, and why are they being the victims of it particularly?
Yeah. That's a yes, absolutely, Pinaki. When you talk about threat multiplier, which is the phrase used by the IPCC, it is right that in India, the multiplication happens most violently at the intersection of three junctures. One is poverty, the other is occupation, and the third is gender. Now, I would like to specify in all the three parts. First is rural women. Okay. Now, there are a lot of studies that have been found out, and they have identified that districts that are highly vulnerable to climate change have children who are more likely to be underweight, women more likely to have non-institutional deliveries. So climate vulnerability is not just a weather problem, it actually undermines your maternal and child health outcomes. So first is the rural women. Also, women are disproportionately affected. Why? Because whenever there is any event, an extreme weather event, it has found, research has consistently showed that women eat less culturally. They will eat less so that their children and husbands can eat more. Okay, they are the last ones to eat, and probably they may not eat at all. So, culturally, this is there. They will walk farther for water whenever the water tables fall. Okay, they are the ones that are going to take up informal, unpaid, or low productivity work when the household income collapses. So women are the ones to be most affected, rural women, and of course they are the ones. In today's time, they are the ones who actually carry all the solutions. Orissa millet model, which I'm talking about, was actually carried by the women. So women are the most affected, I would say, but they are also the change makers in light of climate change. Second are the tribal communities, very, very, highly vulnerable to climate change. There were these studies on Bhil and Belala communities of Madhya Pradesh, okay, and they reported rainfall irregularity, increasing heat wave days, and their capacity to adapt also has severely affected. Why? Because there is poor housing structures, their distance from the health facility is too high, they are dependent on forests which are diminishing. Okay, so these are the ones that but again, like I'll come back to this, that all the solutions to this also lies in the tribal. They have the indigenous knowledge systems, they have the traditional ecological knowledge systems, the solutions. They are the ones who actually have the solutions, because for centuries and centuries they have been able to cope with the changing times. You have your Santhal community, you have your Apatani tribes, these are the ones. You have your Janani systems, they are the ones that are having rich indigenous knowledge systems, ethnomedicinal knowledge systems, and how they are coping in the times of climate change. And this is where our ICMR study comes into being, where we are trying to document and understand how the tribal communities over years with the changing climate are able to adapt themselves to changing climates. Of course, tribal communities most vulnerable, but also have the solutions, the indigenous. Now the issue is, we hope that the vulnerability does not increase so much that a time comes when they are not able to cope with the changing climate. Now this is something where the government has to step in and we have to protect. The third are, of course, the farmers. The third vulnerable groups. So more than half of India's working population, is involved in, we are rain dependent agriculture, and almost a third earns below the international poverty line. So for these families, a single bad monsoon is not an inconvenience. It is actually an existential threat. There's no savings, there's no buffer, there's no insurance safety net. Okay. And climate shocks are always compounding, coupled with the fact that because of the changing climate, they are also increasing in the use of pesticides. This is a study which we conducted with the Department of Biotechnology, and we found that you must have heard about Punjab and the rising case of cancer in the Punjab farmers. So that is unprecedented use of pesticides. Now, why? Why is it happening that? Because as the climate change is happening, your soil is no longer viable. So in order to make it viable, you are using you're using unprecedented, you're using more pesticides so that you have good harvest, good growth, and so that you can sell your product. Santhal tribe, I'll tell you, a tribe which had never heard of pesticides is the one actually using pesticides for the last 5 years. Why? Because there is no growth. If there is without pesticides, without synthetic chemicals, they're not able to grow any crop. So this is where, and what is happening? Are we providing them with protective gears? Are we giving them, all those products to protect them, headgears, safety nets? We don't have any safety nets. So when they are using these pesticides, they are also, getting exposed to the harmful substances. And they are the ones that are, that is affecting the hormones, and then that is causing, that may be leading to cancer. So this is one area where I feel that, climate change, soil getting not viable, too much use of pesticides, and that is causing more of these farmers to be susceptible to diseases. Yeah. So I think these are the three. And so what these three groups have in common is that, the sad part is that they contribute the least to the greenhouse gas emissions. They contribute the least to the greenhouse gas emissions that are changing the climate, and they are the ones that are absorbing most of the severe, consequences. Of course, we have our community health workers, we have outdoor laborers, we have sanitation workers, and all these are definitely severely affected. So, climate change is a global challenge, but its health impacts are experienced very differently from, one community to other.
Yeah, like now that we're talking about the disparities amongst the communities and how they have been handling it with their own resources, their indigenous resources. So my next question is actually highly related to that. So this is how they are internally handling their health situation or climate change situation. But like if as a part of a policy maker or a think tank, if we look at climate change as a global challenge, its health impacts are often experienced like very differently from one community to another, as we just talked about it. Uh, so, like earlier, vector-borne diseases were not very common in the hilly regions, but now malaria is also seen in like the northern parts of India, like the hilly and the mountainous regions. So, why is it so important to understand the climate health risk through a local lens while designing any policies or interventions? As we just talked about the disparities that do exist. So, what that local lens would bring if we put that into the policy making aspect of it.
Absolutely. Local lens is very, very important. We cannot have one size fit all solutions, which have been happening for quite some time. We are just give them one size fits all and our work is done. No, now I'll give you with a simple example, huh? That if suppose there's a heat wave, okay, that registers as a moderate temperature event in the national meteorological average, okay, it may be catastrophic in a district where 80% of workers are outdoor laborers. Okay. Where the wet bulb temperature regularly exceeds safe thresholds and where the nearest primary health center is 20 kilometers away. Okay. So it is going to be very catastrophic for a district like that. Let's imagine. But the same event, if you put it in a more urbanized district with, predominantly indoor work and where there's better health infrastructure, completely different health burden. So a policy response should be calibrated to the national average protects neither population. So if you're going to have an average national average, protection in your policy response, it is not going to help any population. So that is why you need to have policies that are local community specific rather than having a generalized policy with a one size fits all approach. Now, India's own data, it confirms this. Now, agricultural communities, for example, they face a very different suite of risks than coastal farming communities, which face a different risk than forest-dependent tribal communities. Now, I'll give an example of Vidarbha. Like, heat and drought is very common there, and crop failure and death is very common. In coastal Odisha, cyclones are very common. So, salinization of freshwater resources, and they drive the diarrheal diseases and freshwater insecurity. You go to eastern hills, sorry, shifting rainfall patterns affect the food crops. It affects their calendars and create a seasonal hunger. So, so one intervention model cannot address all three. Now, with our 50 years of data, when we analyzed, Pinaki, you'll be surprised to know that Bara region, which was a heat wave, for a heat prone or drought prone region, probably 30 years ago, is now a flood induced region at this time. A coastal belt of Balasore, which was a flood induced region, is now a drought induced region. So the climate pattern, like the first question you asked me, what is climate change? So it's like over the years and centuries, how pattern has changed with all our doings, with all, we are the ones responsible for this. So how it has changed over centuries and centuries. So that is why solutions that were, important for them at that given point of time may not be important to them at this given point of time. And so that is why we need to have solutions that are community specific. And the most effective climate resilience interventions are those that are rooted in your locally contextualized definitions and measurements of climate change. So, as you mentioned, a local lens is very important because, again, I'll come back to this. We generally have a top down approach, we never have a bottom up approach. And the bottom up approach is the one where we go to the communities, we talk to them. They are the ones that possess the unique knowledge and coping mechanisms. And many indigenous communities, if you go to, they have developed their own strategies, their own interventions, their own dealings with the environmental uncertainty. They have the traditional farming systems, they have local crop varieties, they you will be surprised to know the different water conservation practices which they have. And of course they have a community support network, which actually the urbanized centers don't have, the amount of community support networks that they have. And they are the ones that provide valuable lessons for climate adaptation. So the best solution will emerge from scientific evidence and local knowledge when they work together. And definitely, India, when coming to health, India has a critical asset, which is your community health workers, your ASHAs and ANMs. They already operate at the village level, and they are the ones that know which households have a pregnant woman, which households an elderly man lives alone, and all. But again, um, they are themselves vulnerable. The ASHAs and ANMs, with respect to changing climate, they are themselves vulnerable to heat waves. There is no protocol, there is no protection. So, climate adaptation should not be something imposed on communities, it should be developed with communities. Only then, we'll have local solutions to these enlarged problem of climate change.
So now, like addressing the problem through not just the policy angle, but also from the community and the local angle. Uh, it's not that government isn't doing anything. With the launch of NPCCHH and SAPCCHH, they are coming up with ideas. They are coming up with at least an administrative intent, let's say. But if you look at India, like it has made like significant progress in at least recognizing climate change as a public health threat. But where do you still see, now that we're wrapping up the session, where do you see the biggest gaps in our current preparedness and response efforts?
So I would like to, talk about three gaps very quickly. So one major gap is data. Okay, the biggest gap I would feel that we still do not have, strong integrated systems that can accurately measure and track the health impacts of climate change. So many heat-related illnesses and deaths, for example, they remain underreported or misclassified, making it difficult, for us to understand the true scale of the problem. The second is implementation. We have policies and plans, like you said, but they do not always reach the communities most at risk. So So climate adaptation somewhere needs to move beyond documents and become visible in people's daily lives, through better preparedness and all. Third, we need better coordination. Like, climate change affects health, it affects agriculture, it affects nutrition, livelihoods. Yet, these sectors, they all work in silos. So the solution needs to be more, they need to be more interconnected as the things challenge. But I would also consider one more gap, which through my research, which I have found is a knowledge gap. You know, why when discussing climate solutions, we often talk about infrastructural solutions, technological solutions, and policy. They're undoubtedly very important, but like I mentioned, many of these answers already exist within local communities. So now the government of India is also trying to revive, they are trying to revive the traditional knowledge systems, the indigenous knowledge systems, what is there rooted back into our traditions, and so that the communities can help, other communities can take the information knowledge systems and can help to adapt to environmental uncertainty for generations. So took the example of millets. Long before they were recognized globally as a climate smart crop, they were cultivated by tribals and rural communities because they could withstand, drought. But what we often call innovation today, it is traditional wisdom, something that, that is lacking. That, like I said, there's a fourth element which I would like to talk about is that knowledge gap is definitely there. If we actually have documentation of all this knowledge systems in place, definitely that can help us in a long way. So, by three priorities, that I would, like to build upon, or these three gaps are there. What priorities I would like to build upon is that strengthening climate health surveillance so that we better understand who is affected. Of course, protecting vulnerable populations and, building climate resilient food systems. If we're able to, combat these three, we'll be able to achieve.
Okay, so that was like very interesting overall. So the two things that have been imprinted on my head is that the good amount of integration we need right now with the local communities along with the policy at the government level, and secondly, putting these three gaps into picture, especially the knowledge gap, which is like very big challenge and should be addressed head on. So that was a very fruitful session, and I really enjoyed talking to you. Thank you so much for joining us today. And we would look forward to having more such sessions with you in the future.
Thank you. Thank you for having me.
Thank
Thank
you
you.
so much.